The desert heat of Tunisia in May 1943 shimmered over a scene of unprecedented military surrender. Sand swirled around columns of defeated soldiers. Dust clouds rose from thousands of marching feet. The Africa campaign had ended with a massive Allied victory. Nearly 275,000 German and Italian troops found themselves prisoners. Among these captured men walked figures who would soon discover something extraordinary. German medical officers were about to experience treatment unlike anything in military history. What awaited these physician prisoners would challenge every assumption they held about enemy behavior. They expected harsh treatment. They prepared for degradation. Instead, they would find professional recognition that exceeded their own military's standards. Historical documents preserve their remarkable story. Military archives contain detailed records. Post-war testimonies verify the accounts. This unprecedented treatment stemmed from a single international agreement. The 1929 Geneva Convention had established special rules for captured medical personnel. These provisions seemed simple on paper. Implementation would prove revolutionary in practice. The United States had signed this international treaty. American military leaders took these obligations seriously. Geneva Convention mandates were clear and specific. Medical personnel could not be forced into non-medical labor. Officers retained certain privileges regardless of nationality. Most importantly, equal treatment was required for all prisoners. Payment matched American military wages. German officers received the same compensation as their American counterparts. This financial equality shocked prisoners accustomed to different treatment standards. The United States implemented these provisions completely and systematically. German medical officers quickly discovered American adherence to international law. These standards exceeded what they had experienced in their own military system. Fair treatment was not propaganda. It was daily reality in American custody. Transportation to America began the transformation of expectations. Liberty ships carried thousands of German prisoners westward. These vessels would have returned empty from European supply runs. Instead, they transported up to 30,000 prisoners monthly to American ports. New York and Virginia processed the incoming waves of prisoners. The journey itself provided the first glimpse of American resources and philosophy. Substantial meals were served during ocean crossings. Passenger accommodations replaced the cattle cars used in European prisoner transport. This logistical decision created profound psychological impact on German medical personnel. They traveled in actual passenger quarters with regular meals. The contrast with European prisoner transport methods was stark and immediately noticeable. By late 1943, distribution networks spread German POWs across the American continent. Texas became a primary destination for these prisoners. The climate resembled North Africa conditions. Geneva Convention requirements deemed this similarity appropriate for prisoner placement. The Lone Star State hosted numerous camps throughout its vast territory. 3 additional facilities received authorization in 1943 alone. Camp construction accelerated to accommodate the growing prisoner population flowing from North African victories. Fort Sam Houston in San Antonio exemplified these hastily constructed facilities. Canvas tents housed both prisoners and their American guards. Each tent accommodated 176 men in cramped but adequate conditions. The tent city stretched across military reservation land. Camp houses in Gainesville provided different accommodation standards. Camp Hood North in Killeen offered yet another facility design. Medical facilities varied significantly between different installations. Generally, conditions exceeded German medical officers' expectations based on their military experience. Camps maintained comprehensive infirmaries for routine medical care. Some installations featured substantial hospital facilities. These medical centers allowed German medical personnel to practice their profession. Working conditions often surpassed what they had known in German military service. Professional recognition became the most significant aspect of German medical officers' American experience. Captured physicians found themselves working alongside American medical colleagues. American doctors treated German prisoners with the same professional respect shown to Allied casualties. Many documented cases exist of German doctors treating American patients. American physicians provided medical care to German wounded prisoners. This reciprocal professional relationship transcended national boundaries and military conflict. Medical ethics superseded political allegiances. One American doctor reported extraordinary professional collaboration. German physicians taught innovative medical procedures to their American counterparts. American doctors shared their techniques with captured German colleagues. This mutual exchange of medical knowledge occurred freely and frequently. The American Medical Corps maintained consistent standards of care. Wounded German prisoners received identical treatment to Allied casualties. This equality was mandated by international law. More remarkably, it was consistently implemented in practice throughout the American military medical system. Professional courtesy extended beyond symbolic gestures into daily practice. German doctors retained their medical titles in all interactions. They were consulted on complex medical cases. Their opinions were sought and respected in medical discussions. This respectful treatment contrasted dramatically with German expectations. Nazi propaganda had portrayed American society as barbaric and unprofessional. Reality proved completely opposite to these ideological predictions. Professional medical standards transcended national enmity. Medical facilities in American POW camps represented significant investment in prisoner welfare. Camp Butner's convalescent hospital treated nearly 14,000 patients throughout its operation. The facility offered comprehensive services beyond basic medical care. Rehabilitation programs helped patients recover full function after injuries. Social readjustment services prepared men for eventual return to civilian life. Technical and exploratory training provided new skills. Vocational guidance helped prisoners plan post-war careers. General education programs rounded out the comprehensive approach to prisoner welfare. By late November 1945, staff numbered 2,200 personnel. These professionals were assisted by 414 German prisoners of war. Patients received round-the-clock attention from this integrated medical team. These facilities served both American military personnel and prisoners of war simultaneously. This integration created remarkable medical environments where former enemies worked as colleagues. German medical staff collaborated with American personnel on a daily basis. Equipment quality and supply availability often exceeded German military hospital standards. These American facilities surpassed what German medical installations had possessed even before wartime destruction. The contrast became more pronounced as Germany's infrastructure deteriorated under Allied bombing. Educational opportunities for German POWs would have been remarkable even for free citizens. Nearly every camp maintained extensive libraries of donated books and magazines. Some collections rivaled average high school libraries in size and scope. Camp Fanning maintained over 2,500 books, with 80% circulation rates among prisoners. Medical personnel gained access to current medical literature and professional journals. These resources had been restricted or completely unavailable in Nazi Germany due to wartime conditions. Nazi censorship had eliminated non-Aryan medical research from German libraries. American camps provided uncensored access to international medical advances. This intellectual freedom proved as valuable as the physical resources available to German medical personnel. Some camps established remarkable connections with American universities and medical schools. A report from Camp Butner in April 1945 documented extensive university collaboration. 110 prisoners worked as mess attendants at Duke University and the University of North Carolina. While these prisoners worked in non-medical capacities, the university connections provided access to American academic medicine. German medical personnel in these camps gained exposure to cutting-edge research and teaching methods. Such integration between enemy prisoners and American institutions would have been impossible in Nazi Germany. Labor shortages created by overseas military deployment eventually led to prisoner work programs. Millions of American soldiers served in foreign theaters. German POWs helped fill resulting gaps in domestic labor needs. They worked in canneries, mills, farms, and other locations deemed minimal security risks. Medical personnel often found themselves assigned to hospitals and medical facilities. Their professional skills were utilized rather than wasted on menial tasks. This practical application of their medical training maintained their professional competency during captivity. German medical officers who volunteered for medical work received compensation according to Geneva Convention requirements. Payment reflected their rank and professional position. This modest compensation represented recognition of their professional status and dignity. Men who expected treatment as defeated enemies instead found professional acknowledgement. This financial recognition profoundly affected German medical officers' morale and self-perception. Respect replaced the degradation they had anticipated. Increasing numbers of German POWs presented logistical challenges for American medical facilities. Initial concerns arose among nursing staff about providing care to enemy personnel. Some wondered whether personal feelings could be set aside for professional duties. Official policy clearly prioritized Allied casualties over enemy prisoners in medical care allocation. Despite these policy guidelines, most nurses quickly adapted to treating German patients. They discovered they could view these men simply as patients requiring medical attention. Professional duty overcame national enmity in daily medical practice. German soldiers received the same quality nursing care as American military personnel. This professional integration occurred despite initial reservations and official policies favoring Allied casualties. American medical personnel demonstrated the ability to separate professional responsibilities from political ideology. This provided German medical officers with a powerful example of medical ethics transcending national boundaries. Such professional behavior influenced their understanding of medical practice. German medical personnel witnessed medical supply abundance that contradicted their wartime scarcity experience. Basic supplies like bandages, medications, and surgical instruments were available in unprecedented quantities. German military medicine had not seen such abundance since before the war began. Pharmaceutical availability, particularly impressed, captured German medical officers. Sulfa drugs had been carefully rationed in German military medicine throughout the war. American facilities used these medications liberally without concern for conservation. The contrast highlighted American industrial capacity versus German resource constraints. Penicillin introduction to some facilities by 1944 represented therapeutic capability completely unknown to German medicine. This revolutionary antibiotic was unavailable to German medical personnel throughout the war. Access to such advanced medications demonstrated American pharmaceutical superiority. Medical treatment provided to German POWs matched standards for American military personnel. German wounded received identical surgical procedures and rehabilitation services. Medications were distributed equally regardless of nationality. This treatment equality mandated by Geneva Convention was consistently applied in American medical facilities. German medical officers observed and participated in equal treatment protocols. They gained experience with American medical procedures and ethical standards. This knowledge would influence their post-war medical practice when they returned to Germany's devastated medical system. Texas' concentration of POW camps created large populations of German prisoners, including medical personnel. Camp Butner's scale exemplified American facility investment. Located across 40,000 acres spanning 3 counties, it served as a major combat infantry training facility. Training exercises prepared an estimated 30,000 American soldiers at this massive installation. German and Italian prisoners performed various support duties throughout the facility. They served as cooks and maintained facility operations. The scale exposed German medical officers to American military medicine at its most developed. Professional relationships between American and German medical personnel developed despite prisoner-captor constraints. These relationships included genuine professional knowledge exchange. American doctors learned trauma treatment techniques from German colleagues with extensive battlefield experience. German doctors absorbed American advances in antibiotics, anesthesia, and surgical techniques. These exchanges are documented in post-war accounts and military records. Such professional collaboration between enemies was unprecedented in modern warfare history. American nursing roles provided German medical personnel with insights into different medical care approaches. American nurses possessed more authority and autonomy than their German counterparts. They participated in medical decision-making and performed procedures reserved for physicians in Germany. German medical officers working alongside American nurses had to adjust their expectations about medical hierarchy. This adjustment challenged their assumptions about proper medical practice organization. The experience broadened their understanding of effective medical team structures. Space at Fort Sam Houston accommodated up to 1,000 German POWs beginning September 15, 1942. This arrangement provided temporary housing while permanent POW camps were constructed elsewhere. Fort Sam Houston's reputation as the home of Army medicine made it an ideal location. The fort's role as a major medical training facility exposed German medical personnel to American military medical education methods. While their participation was necessarily limited, observation provided insights into different approaches to medical training and professional development. Dental care in POW camps often receives little attention in historical accounts. German dentists among prisoners worked in camp dental facilities, maintaining oral health for thousands of fellow prisoners. These dental officers experienced the same professional recognition as medical colleagues. American investment in prisoner dental health demonstrated commitment to comprehensive welfare. Routine dental care was provided rather than just emergency extractions. This approach exceeded Geneva Convention requirements and surprised German dental officers accustomed to minimal dental care in military settings. German medical officers participated in public health measures within camp environments. Disease prevention programs required their professional input and support. Sanitation supervision fell partly under their responsibilities. Health education initiatives utilized their medical knowledge and authority. These activities exposed them to American public health approaches, emphasizing prevention over treatment. This philosophy contrasted with German military medicine's focus on battlefield trauma treatment. The success of preventive measures in maintaining camp health despite crowded conditions provided practical demonstrations of American preventive medicine effectiveness. American approaches to mental health treatment particularly affected German medical personnel. Combat fatigue, later termed PTSD, was recognized and treated as a legitimate medical condition. This differed dramatically from German military psychiatry's approach to psychological casualties. German military medicine typically viewed psychological breakdown as cowardice or character weakness. American treatment methods included psychotherapy, occupational therapy, and pharmaceutical interventions. This comprehensive approach contrasted sharply with German military psychiatry's punitive methods for treating psychological casualties. German psychiatrists and psychologists among POWs observed these treatment methods firsthand. They witnessed therapeutic approaches that emphasized healing rather than punishment. This experience influenced their understanding of mental health treatment possibilities. War's end brought repatriation challenges for German medical personnel. Many had spent 2 or more years in American custody, practicing medicine under excellent conditions. These conditions often exceeded what they had known as free physicians in wartime Germany. The repatriation process included medical examinations and health certifications. These procedures were conducted jointly by American and German medical personnel. This final professional collaboration reinforced collegial relationships developed during captivity years. Approximately 5,000 Germans eventually emigrated permanently to the United States. Thousands more returned later as visitors rather than immigrants. Many farmers recalled their POW laborers with genuine admiration and lasting affection. Indeed, warm friendships developed and persisted long after the war's end. Professional connections between medical personnel were maintained among these lasting relationships. German medical officers returning to Germany brought knowledge of American medical practices with them. Their influence on post-war German medicine was significant, though difficult to quantify precisely. Medical ethics, patient rights, and professional standards were areas where American influence was particularly notable. These returning officers advocated for reforms in German medical practice based on their American experience. Their advocacy contributed to improvements in post-war German medical care. German medical personnel's exposure to American medical education methods influenced post-war German medical training. Emphasis on practical clinical experience impressed German educators. Integration of basic science with clinical practice provided a model for curriculum development. Systematic approaches to resident training offered improvements over traditional German medical education. Returning German medical officers advocated for these methods in rebuilt German medical schools. Several became prominent medical educators in post-war Germany. Connecting their teaching methods directly to POW experience remains historically challenging. Personal papers and institutional records would provide definitive evidence. Nevertheless, the influence of American medical education exposure is apparent in post-war German medical training reforms. Documentation of German POW medical personnel experience comes from various sources. Official military records in national archives provide governmental perspectives. International Red Cross inspection reports offer neutral observations. Post-war memoirs and oral histories preserve personal experiences. Contemporary newspaper accounts captured public reactions to prisoner treatment. Camp newspapers published by POWs themselves provide insider perspectives. These sources offer valuable insights while leaving many questions about professional relationships and knowledge transfer unanswered. German pharmacists and pharmacologists among POWs gained exposure to American pharmaceutical practice. Mass production techniques impressed prisoners accustomed to small-scale German pharmaceutical manufacturing. Quality control standards exceeded German military pharmaceutical supply standards. Distribution systems ensured consistent medication availability throughout medical facilities. This knowledge proved valuable in rebuilding Germany's pharmaceutical industry after the war's destruction. Medication availability in American camps demonstrated production capabilities exceeding German pharmaceutical industry achievements. Exposure to American pharmaceutical abundance influenced German medical personnel's understanding of modern medicine's potential. Adequate resources could support medical capabilities they had never experienced. This understanding shaped their expectations for post-war German medical reconstruction. Surgical knowledge exchange between American and German medical personnel represented practical professional interaction. German surgeons shared trauma treatment techniques developed through extensive battlefield experience. Years of combat medicine had refined their emergency surgical capabilities. American surgeons shared advances in anesthesia techniques and aseptic surgical methods. Post-operative care protocols represented another area of American surgical superiority. This bidirectional knowledge transfer enriched both medical communities despite language barriers and security constraints. German medical technologists and laboratory specialists worked in camp laboratories supporting medical operations. They conducted routine diagnostic tests and maintained laboratory equipment. This work provided exposure to American laboratory methods and equipment standards. Quality control procedures in American laboratories often exceeded German military medical laboratory capabilities. Systematic approaches to laboratory medicine included standardized procedures and comprehensive record-keeping. Regular equipment maintenance ensured consistent laboratory performance. These laboratory medicine models influenced post-war German laboratory development. Returning German laboratory specialists advocated for improved standards and systematic approaches. Their influence contributed to modernization of German laboratory medicine after the war's destruction. German radiologists and X-ray technicians operated equipment in camp medical facilities. American radiology equipment impressed personnel accustomed to maintaining deteriorating German equipment with scarce replacement parts. Reliability and image quality exceeded German military radiology standards. Safety protocols in American radiology practice provided important examples of radiation protection. These measures protected both patients and operators from unnecessary radiation exposure. Such safety consciousness exceeded German military medical radiation safety standards. Exposure to comprehensive radiation safety influenced post-war German radiology practice. Returning German radiologists advocated for improved safety protocols based on American examples. This advocacy contributed to enhanced radiation safety in reconstructed German medical facilities. International Red Cross played crucial mediating roles in German POW medical personnel experience. Red Cross inspections verified Geneva Convention compliance, including professional recognition and appropriate work assignments. These inspections provided neutral oversight of prisoner treatment. Red Cross packages supplemented medical supplies in some camps. American military medical supply was generally adequate without these supplements. More importantly, Red Cross facilitated communication between German medical personnel and international medical communities. This communication maintained connections to broader medical developments beyond camp boundaries. Such connections helped preserve professional identity during captivity years. International medical community contact provided intellectual stimulation and professional development opportunities. POW camp newspapers written by prisoners provided platforms for German medical personnel to maintain professional identity. These publications were subject to American censorship, but generally allowed considerable editorial freedom. Medical and health content written by German medical personnel appeared regularly. Articles covered health education topics, disease prevention methods, and medical news relevant to prisoner populations. These publications allowed German medical personnel to share knowledge with fellow prisoners. The newspapers preserved in various archives provide insights into German medical personnel's perspectives on their experience. Limited medical research opportunities were permitted for some German medical personnel in American captivity. Research focused on non-sensitive topics, such as nutritional deficiencies among prisoner populations. Disease pattern studies in camp environments were also permitted. Laboratory facilities and statistical support for research exceeded what many German medical researchers had available in wartime Germany. Deteriorating research infrastructure in Germany made American research opportunities particularly valuable. Maintaining research skills during captivity prepared German medical personnel for post-war scientific careers. Disease outbreaks in POW camps required coordinated medical responses, bringing American and German medical personnel together. These epidemic situations demanded urgent collaboration, transcending prisoner-captor relationships. Influenza outbreaks tested camp medical capabilities and response protocols. Gastrointestinal infections and other communicable diseases required systematic epidemic control measures. German medical personnel participated in outbreak investigations and containment measures. They gained practical experience in mass treatment protocols and public health emergency response. This experience proved valuable for post-war Germany's challenging public health conditions. Epidemic control knowledge helped German medical officers address health crises in war-devastated German communities. American epidemic response methods provided models for effective public health intervention. German medical officers observed American medical supply management systems, ensuring consistent material availability. Systematic approaches to inventory management prevented supply shortages. Emergency stockpiles maintained adequate reserves for unexpected medical needs. Distribution networks efficiently delivered medical materials throughout large medical systems. These supply chain management methods provided models for efficient medical logistics. Knowledge of effective supply management influenced German medical officers' understanding of modern medical system requirements. This understanding proved particularly relevant for rebuilding Germany's destroyed medical infrastructure. Consistent supply availability was essential for effective medical care delivery. American supply chain examples provided blueprints for German medical system reconstruction. Combat wound treatment in camp hospitals exposed German medical personnel to American advances in wound care. Liberal antibiotic use prevented infections that commonly complicated wound healing. Advanced surgical debridement techniques improved healing outcomes significantly. Systematic wound documentation provided data for treatment improvement and outcome tracking. These protocols represented advances over German military medical wound care practices. German medical personnel observation and participation in American wound care influenced post-war German trauma medicine development. Improved civilian trauma victim outcomes resulted from knowledge gained during POW experience. American trauma medicine techniques were adapted for post-war German medical practice. This knowledge transfer contributed to enhanced emergency medical care in reconstructed Germany. American emphasis on preventive medicine in POW camps exposed German medical personnel to different medical philosophy. Routine health screenings identified potential health problems before they became serious. Vaccination programs prevented epidemic diseases in crowded camp conditions. Health education initiatives empowered prisoners to maintain their own health through informed choices. This prevention-focused approach, while not unknown in German medicine, received lower priority in German military medical practice focused on battlefield trauma treatment. Exposure to comprehensive preventive medicine programs influenced German medical personnel's post-war practice philosophy. Prevention-oriented approaches were incorporated into their medical care delivery after returning to Germany. This influence contributed to improved public health outcomes in post-war German communities. American rehabilitation medicine for wounded soldiers impressed German medical personnel with its comprehensive approach. Emphasis on returning wounded soldiers to maximum function replaced simple invalid pension systems. This philosophy represented fundamental differences in disability treatment approaches. German medical personnel observed physical therapy, occupational therapy, and vocational rehabilitation programs. These comprehensive rehabilitation services exceeded anything available in German military medicine during the war. The systematic approach to functional recovery provided models for post-war German rehabilitation medicine development. This exposure influenced German rehabilitation medicine after the war's end. Comprehensive rehabilitation approaches were advocated by returning German medical officers. Their advocacy contributed to improved disability treatment in post-war German medical systems. American medical communication methods between professionals, with patients, and in documentation differed significantly from German practices. Clear documentation standards improved medical record-keeping and treatment continuity. Patient education initiatives helped patients understand their conditions and treatment options. Interdisciplinary communication facilitated coordination between different medical specialties and healthcare providers. These communication methods provided models for effective medical information sharing. German medical personnel exposure to these methods influenced their post-war practice approaches. Patient-centered and collaborative medical care became more prominent in rebuilt German medicine. Communication improvements contributed to enhanced medical care quality in post-war German medical systems. American examples provided blueprints for effective medical communication practices. The experience of German POW medical personnel in American captivity demonstrates professional identity's ability to transcend national enmity. American medical personnel treated captured German physicians as respected colleagues worthy of professional recognition and interaction. Teaching and learning occurred freely between former enemies united by medical profession commitments. These professional relationships established during captivity often outlasted the war itself. Personal friendships developed alongside professional collaborations in many documented cases. The full extent of knowledge transfer and professional relationships remains incompletely documented in available historical sources. Nevertheless, evidence confirms that German medical personnel experienced professional recognition exceeding their expectations. In many cases, treatment surpassed their previous experience in German military medicine. This professional treatment was not universal or without significant problems and limitations. Security constraints necessarily limited full professional integration between former enemies. Language barriers complicated communication and knowledge transfer in many situations. The fundamental prisoner-captor relationship created inherent limitations on professional collaboration possibilities. Some American medical personnel maintained professional distance from German colleagues. Similarly, some German medical personnel resisted American approaches and methods. Nevertheless, documented experiences of German POW medical personnel in America represent remarkable chapters in military medical history. The decision to treat enemy medical personnel as professional colleagues reflected American adherence to international law and fundamental American medical values. Impact extended beyond individual German medical officers to influence post-war German medicine broadly. While direct causation remains difficult to establish definitively, German medical officers who experienced American medicine in captivity contributed significantly to post-war German medical reconstruction. Knowledge of American methods, ethics, and organizational approaches was brought back to Germany by returning medical officers. Their influence on rebuilding German medical systems was substantial, though difficult to quantify precisely. Professional networks established during captivity facilitated ongoing knowledge exchange after the war. The story of German POW medical personnel in America ultimately demonstrates medicine's capacity to maintain professional bonds even during warfare. Professional obligations and ethical commitments proved stronger than national boundaries and military conflicts. American military medicine's treatment of enemy medical personnel with professional respect extended beyond simple adherence to international law. It demonstrated values that transcended temporary military conflicts. These demonstrations of professional ethics provided examples for contemporary military medicine and international medical relations. Historical examples of professional respect surviving warfare remain relevant for modern military medical ethics. International medical cooperation continues to be guided by principles demonstrated in American treatment of German POW medical personnel during World War II. The principle that medical professionals share universal obligations, transcending national boundaries, was powerfully demonstrated through this historical experience. These obligations continue to guide military medical ethics and international medical cooperation in contemporary practice. German medical officers who experienced American professional collegiality rather than expected enemy treatment returned to Germany carrying more than medical knowledge and technical skills. They brought with them transformative experiences of professional respect, surviving even warfare's brutalities. These men carried proof that medical ethics could transcend political ideology and national hatred. They had witnessed former enemies becoming medical colleagues united in medicine's universal mission of healing human suffering. This experience provided hope for professional collaboration, transcending political boundaries. The knowledge that professional respect could survive warfare's destruction provided foundation for post-war international medical cooperation. German medical officers who experienced American collegiality became advocates for international professional collaboration in rebuilding German medicine. Their influence extended beyond technical knowledge to encompass fundamental professional values and ethical commitments. The experience that former enemies could become colleagues in healing's universal mission continued to inspire international medical cooperation long after the war's end.